Primary care networks across the county are recruiting community GPs to support the delivery of the NHSE Ageing Well programme. This poses an excellent opportunity for GPs with an interest in community-based and truly patient-centred care. Because the work that community GPs are doing is slightly different to a typical GP day, we've asked a number of community GPs from across the county to speak a little bit about what they do.
The community GP role is a new, different role to what we've been used to in general practice. It works well both with regard to a special interest in something like frailty, but also as a portfolio career alongside general practice sessions. With regard to appraisal, it is recognised as standard general practice.
So this has been a really interesting role for me. I've been able to be involved in the service development elements of what we're doing within Team Up, but I also work as a community GP clinically and do visits. It means that our most housebound and frail patients get a more holistic service. It means we can spend longer with them. I can do a lot of advanced care planning. I can talk to patients about all sorts of different problems that they're having, as well as work within an MDT quite closely. The other thing that's great about being a community GP is that you get to work in a team again. So for someone like myself who worked in hospital for several years, I was able to come out of a GP room where I'd sometimes be working for 11, 12 hours on my own and be back in a team. So I now have a team of ANPs, ACP trainees, I have matrons and I have HCAs who work in my office space.
Part of the community GP role is leading and supporting the multidisciplinary team. Through discussing clinical cases at the MDT, there is great opportunity for all members of the team to learn from each other, from specialists and from more junior members of the team from their variety of experiences. This can include people from physio and medical backgrounds such as geriatricians and community mental health team workers, but also from specialist nursing backgrounds and social worker teams.
I'm getting great job satisfaction from working with and training paramedics, trainee ACPs and GP registrars as part of my role as a community GP. The potential for integrated working across community services is vast. My role as a community GP includes remote triage, clinical advice and supervision, and I also get the chance to undertake community visits without other pressures on my time. We're working towards a deeper integration with community services as well, with the aim for more joined up care in the community.
The services that community GPs are supporting includes enhanced health in care homes, urgent community response and home visiting, and anticipatory care. The models and the delivery of these services might vary slightly, but essentially all are aiming to support people in the community to live well for longer in the place that they call home.
This role provides an exciting opportunity to be involved in service development and service design, as well as contributing to quality improvement if that's something that you're interested in.
It really feels like you're part of a bigger team delivering holistic care to vulnerable housebound patients.
Our patients are really grateful for this service, and I think it's a service they really need. They're often generally quite ill with a lot of comorbidities, and they're so pleased that someone's been to see them, and that just makes the job so much more rewarding. So I'm just really happy that we're starting to use this initiative within the community.
For anyone who's interested in understanding more about or applying for a role as a community GP, please do get in touch with your local PCN, myself, or one of the GPs featured in this film. Thank you for your time.